The thought of being in an office building, a restaurant, or on public transportation has never been more frightening as evidence emerges about just how efficiently the novel coronavirus can spread through crowded indoor spaces. A case report published last month in the academic journal Emerging Infectious Diseases detailed how one pre-symptomatic person infected 9 others at a restaurant in Guangzhou, China. The 10 people were spread out across 3 tables and overlapped in the restaurant for roughly 1 hour. The researchers suspect that an air conditioning unit recirculating air within that section is to blame since no one else in the restaurant became infected. The magnitude of the outbreak illustrates how a high-density work environment can become a high-risk site for the spread of COVID-19 and potentially a source of further transmission. Fairly large droplets that are coming from people talking, coughing, sneezing, breathing, singing will float in the air depending on how much air movement we have. The study concludes, the transmission of respiratory infections such as SARS-CoV-2 from the infected to the susceptible is an indoor phenomenon. These reports have added to the debate about whether the virus could be airborne and raised concerns about how to open up the economy safely without putting employees and customers at risk. By some definitions, airborne transmission depends on the size of the particles being spread, with only aerosols, which are less than 5 microns in size, qualifying as airborne. Particles larger than 5 microns are classified as droplets, which are heavier and so drop to the ground faster. But most scientists say this cutoff is a false dichotomy that oversimplifies the matter, and in many situations a droplet can also be airborne. Aerosol means that it's something that can float in the air, and how big it can be depends a lot on how much movement there is in the air, Milton says. The virus itself is only 1/10 of a micron, but it travels in wet mucus particles created by breathing, talking, coughing, and sneezing that range in size. Another definition of an airborne infection relies on the result rather than the mechanism. This definition is based on 2 additional factors besides the size and flight pattern of the viral particles. While not every virus can survive in tiny aerosols, a heavily cited study from the New England Journal of Medicine found that SARS-CoV-2 does for up to 3 hours. The other factor is the impact of the particle's size on seeding an infection. Large droplets can't get deep into the lungs, so a virus that only survives in larger droplets would have to be able to enter the body through cells in the nose. On the other hand, some viruses infect cells in the lungs first, so they would need to remain viable in smaller aerosols. Right now, scientists are fairly certain people can become infected with SARS-CoV-2 in the upper respiratory tract, but they don't know if an infection can be initiated from tiny aerosols that bypass the nose and travel down to the lungs. A recent study published in Nature found coronavirus RNA in the air in 2 hospitals in China, although the researchers did not establish if the virus was able to infect people. The concentration of the virus varied dramatically depending on where in the buildings the scientists tested. Aerosol virus levels were virtually undetectable in specially ventilated patient rooms and open-air public waiting areas. However, poorly ventilated rooms, such as patient bathrooms, had high levels of airborne virus. The research raises the issue of the importance of ventilation and what types of environments and filtration systems might be safest. The more ventilation clearly the better because it has a filtration system and it's going to remove something which is airborne, says Pratham Biswas, Ph.D., chair of the Department of Energy, Environmental and Chemical Engineering at Washington University in St. Louis. An ICU, a critical care unit in the hospital, has excellent ventilation. If I go to a shop or grocery store, it also has ventilation, but because it's such a large area it's very difficult to rely on just that. At the highest end of filtration systems are clean rooms, like in the ICU, that use a very high flow rate with extremely clean air to eliminate all foreign particles. At the other end of the spectrum is the humble filtration step of opening a window. Office buildings, retail spaces, and airplanes fall somewhere in between, with a central air conditioning system that either pulls in air from outside or recirculates air within the building. In both cases, the air is run through a filter to remove the particles, although the quality of the filter can vary widely. The system also breaks down when people enter and leave the building, which brings in outside air that isn't immediately filtered. Mechanical ventilation systems that have appropriately sized cooling and heating capacity can bring air in from outside and dilute the aerosols indoors, Milton explains. In that way, you can break up the amount of virus that accumulates in a room. Even with the best filtration system, BISVAS still recommends physical distancing as the first and most effective way to keep yourself safe. The second way is to wear a mask. Battles about shelter-in-place requirements have been particularly contentious around public outdoor spaces like parks, trails, and beaches. Outside, the movement of the air provides us some degree of protection, says Martinello. I haven't seen any data specific to SARS-CoV-2 yet, but we know with other pathogens that sunlight does, in fact, have a disinfecting property. It's definitely better than an indoor enclosed environment, BISVAS agrees.